Hi, my name is Michaela Davis, and today I will be discussing whether or not assistive reproductive technology, or ART, should be used in humans. In order to first answer this question, I think that it is important that we understand how natural fertilization works. So, according to the Center for Disease Control, natural fertilization has 5 steps. The first step is that the eggs are released from the ovaries and they travel down the fallopian tube. The second step is that the sperm travels up the fallopian tube. The third step is that the eggs and the sperm combine and the sperm fertilizes the eggs. The fourth step is that the fertilized egg will travel down the fallopian tube and into the uterus. And the fifth step is this fertilized egg or zygote will implant itself into the uterine lining, and if it does this successfully, then pregnancy can occur. So the types of art that I'm going to be discussing today are in vitro fertilization, or IVF, intracytoplasmic sperm injection, or ICSI, and gamete intrafallopian transfer, or GIFT. So, what is assistive reproductive technology? According to Planned Parenthood, assistive reproductive technology is any fertility-related treatment where eggs or embryos go through manipulation. And it is important to note that this does not involve procedures where only male sperm is dealt with, and this does not involve procedures that only include ovarian stimulation. But what it does involve is the surgical removal of eggs from the female body, the synthetic joint with male sperm, and the insertion of this combination back into the female body. The first type of art that I'm discussing today is in vitro fertilization, and according to Planned Parenthood, there are 5 steps of IVF. The first step is that a female takes a fertility medication in order to assist the ovaries in producing healthy, mature eggs. The second step is that the eggs are retrieved from the follicle using a suction device. And the third step is that multiple sperm and multiple eggs are placed in a dish together where fertilization can occur. The fourth step is that a specialist will identify the most mature fertilized egg and it will be inserted into the female uterus. And if this fertilized egg successfully implants into the uterine lining, then a pregnancy will occur. The second type of art that I'd like to discuss today is intracytoplasmic sperm injection, or ICSI. And according to the Cleveland Clinic, there are 5 steps of ICSI. The first one is that 10 to 12 eggs are retrieved from the female body. The second step is that the most mature eggs are identified, and each of them is injected with a singular sperm. The third step is that the fertilized eggs are then incubated for a maximum of 6 days. And the fourth step is that the most mature zygote is implanted into the female uterus. And the fifth step is that a pregnancy will occur if this fertilized egg successfully implants itself onto the uterine lining. The third form of art that I would like to discuss today is gamete intrafallopian transfer, or GIFT. And there are 5 steps of GIFT. The first one is that the eggs are collected from the ovaries. The second is that the eggs and the sperm are mixed together in a dish. And the third step is that this mixture is immediately injected into the fallopian tube in the female via a small, thin tube. The fourth step is that fertilization is now able to occur in the fallopian tube. And the fifth step is that if an egg is successfully fertilized, then it can travel down the fallopian tube into the uterus where it can successfully implant into the uterine lining, and if it does, then a pregnancy will occur. So, according to the Center for Disease Control, infertility is a condition of the reproductive system where conception cannot occur naturally. And individuals are described as infertile when they are unsuccessful with obtaining a pregnancy after a year of trying. So, some common causes of female infertility are ovulation disorders, endometriosis, fallopian tube damage or blockage, cervical mucus abnormalities, and uterine fibroids. So, these reasons of female infertility and just infertility in general are the most common reasons why people turn to art, but there are also other reasons, which I will discuss now. One of them being that they use art in order to screen their child for genetic diseases. And according to a study from Giobetti et al., Pre-implantation genetic diagnosis, or PGD, is testing done that is used to screen an embryo prior to implantation in the female, and it is screened to look for abnormalities in chromosomal number and structure. Some common disorders that are found when this process occurs are Turner syndrome, Klinefelter syndrome, and Edwards syndrome. So in Turner syndrome, the offspring will have a webbed neck, a short stature, and they will be sterile. In Klinefelter syndrome, the offspring will have female breasts, male genitalia, and they will be sterile. And in Edwards syndrome, the offspring will rarely live past 1 week, and they will have clenched hands, clenched feet, and mental retardation. And if an embryo is showing positive for any of these chromosomal abnormalities that are going to cause these conditions, then that embryo will not be used any further in any form of art. So a third reason that people decide to use art is that it provides an avenue for cancer patients to preserve their fertility. As everyone knows, radiation treatments have many harmful effects on the body, one of which is that it can decrease your fertility rate. So when the eggs are removed from the body prior to the beginning of radiation, these eggs can later be used in many forms of art in order to still achieve a pregnancy. So to answer the question, should people use art, we obviously have to discuss the negatives. So there are some medical risks to the mother with art, one of which is that there is a 7% chance of having twins when using art, which is different compared to the 1 to 2% chance risk of having twins when using natural conception. And the reason why this is a risk is because it is harder to birth twins than it is to birth a singular child. And additionally, there is a higher risk of ovarian torsion when using art compared to natural conception. There are also some medical risks to the child, and in a study done by Davies et al., he observed 308,974 births, and of these births that were conceived with art, 8.3% of them had congenital birth defects, where compared to those achieved with natural methods had a 5.8% risk of congenital birth defects. But it is important to note in this study that no pre-implantation genetic disorder testing was done, and that the female's lifestyle conditions were not taken into account at all, meaning that they did not screen for the use of alcohol during the pregnancy. Additionally, there are 3 main ethical concerns according to the Journal of Reproductive Technology. The first one is what occurs to the embryos that were not selected to be implanted into the female. And this goes with the whole argument of when life is considered life, meaning is it life right when the sperm is injected into the egg, or is it life after weeks or months of development? The second ethical concern is the buying and selling of human gametes during egg and sperm donation. And obviously there are strict guidelines that need to be followed during this, and it becomes an ethical concern when these guidelines are bent. And the third ethical concern is that the eggs are extracted from the female, and the female or happen to pass away before these eggs could be used in a form of art. Who now has ownership to the eggs? And another negative of art is that it does have a large financial burden, meaning that one round of IVF can cause up to $15,000 if insurance does not cover it. So to recap, my question that I was deciding to answer is, should art be used in humans? And in summary, art can help women overcome infertility, it can be used to avoid genetic disorders, and it can help cancer patients to preserve their fertility. Because of these 3 major benefits, I believe that art should be used in humans and that the positives outweigh the negatives. So art is a fairly new concept, and the first successful procedure was only done in 1976. So I do believe that art has a long way to come, and that there will be many new advances with art as the medical field continues to advance.